Now, we have to talk about vaccine supply. We're told there are supply issues, 1.7 million doses becoming 1.1 million. Um, what's happening there? I mean, who's letting you down?
So the 1.7 figure, to be honest, I think was in an internal document for a day. The figure we have always been planning to is 1.2 or 1.25, and that looks like it might be closer to 1.1. So it's still obviously very high relative to the forecasts. The company that has been repeatedly revising down its forecasts is AstraZeneca. Moderna have been coming in pretty much on schedule. There was a bit of a wobble last week, but pretty much on schedule. Though they're a relatively low amount. They're just over 100,000 of this 1.1 million. Pfizer, to their credit, there have been a few wobbles, but by and large, the supply has been the amounts that were agreed when they were agreed.
Okay.
The issue repeatedly has been AstraZeneca.
Have we then gone about trying to find another way to get more supply? Because I look at Boris Johnson, who made a terrible hames of the coronavirus pandemic at the beginning, but now he's seizing victory from the jaws of defeat by vaccinating huge swathes of his population very, very quickly. So the question is this government doing anything to secure more supplies? Be ready, for example, for Sputnik when it's approved, go outside the EU system of procurement?
So the first thing to do is to make sure we maximise allocations from within the EU. So we've opted
But
into
we have a
our full
guaranteed 1.1% of whatever the EU secures. We're guaranteed that, are we not?
Well, you've got to opt into that. So not every country has opted into its full allocation. We've opted into the full allocation, and we've opted into these what they're called as top-ups as well. So through that, we've advance purchased enough vaccines, about 18.5 million doses. It's enough to vaccinate every man, woman, and child in the country twice. So the issue isn't so much around supply. The issue is timing. Everybody wants to get this vaccine as quickly as possible because the results we're seeing from our nursing homes, the results we're seeing from our hospitals, the results we're seeing from the UK, from Israel, are absolutely astonishing.
Okay, but
and
the
so
point
there's
is,
a really high demand for it.
Have we done anything to get more?
Well, look, we're in constant communication with all of the pharmaceutical companies. We're in constant communication with other governments. But the idea that there are other countries out there who are just going to give us their vaccines before they vaccinate their own people obviously doesn't hold up. They're not doing it. We wouldn't do it. The idea that there are, warehouses somewhere around the world full of legitimate vaccines that we can just go and take, or indeed any country can go and take, it doesn't stack up either. So, for example, yesterday there was some commentary that, someone was going to be able to get us, some, private citizen was going to be able to get us a load of AstraZeneca vaccine. We spoke to AstraZeneca, who said very clearly there is no private sale, supply, or distribution of their product. So the people we need to be talking to are the pharmaceutical companies. We're talking to them all the time, and the EU Commission, and we're talking to them all the time.
Any prospect of manufacturing vaccines here under license? We have a very competent pharma sector.
We sure do, and I'd say they have capacity to do a lot. Really, they're operational decisions for the pharmaceutical companies. What I was told
there was some reporting that the government approached Pfizer and Merck with a view to doing things to their plants in Cork and Carlow, respectively, but the answer was no.
Well, my understanding is what the pharmaceutical companies have done is shift other production to Ireland to free up capacity to do the vaccine manufacture. But I think the important note out of this, Pat, is even if it was all being produced in Cork or Dublin or Galway, it wouldn't increase our supply because we're part of the EU distribution.